Sexuality and pregnancy, I feel like there's a lot of myths around what's okay and what's not. In a low risk pregnancy, pretty much anything's okay that you were doing before, as long as you're comfortable, you're not going to cause a miscarriage. That's another myth. I think that sometimes, as particularly men, think that they're going to hurt the baby, or even a woman might be concerned about that, but that's not a valid concern. There's no evidence showing that sex during pregnancy can increase miscarriage. Miscarriages are due to, non-formation of the baby or whatever. It's not going to be caused by sexual activity. So doing anything that you pretty much did before, there may be some uncomfortability in previous positions, especially once you get into like the third trimester. So there might be some exploration that you might want to do to make it more comfortable. But anything that you were doing before is pretty much okay. There are some contraindications if you're having any vaginal bleeding, or if you have placenta previa, or any kind of infection or anything like that that might need to be taken care of. Those are some things that you definitely want to talk to your provider about and make sure that that is addressed. Some other things that might come up are, body image. Obviously, your body's going to change quite a bit. Your breasts are going to get bigger, your body, your abdomen, everything like that, you're going to get bigger. So a lot of women have struggled with the body image part of, sexuality. And that's something that is usually more mental than anything else. Because just from experience with patients and things like that, like I feel like, most men enjoy their woman's pregnant body, or their partners enjoy their partner's pregnant body. So I feel like that's something that we put on ourselves, the stress that we put on ourselves, but that can lead to some apprehension about sexuality and pregnancy. So there's definitely things that you can do as far as you might want to even see a counselor about that, if you're having some body image issues and things like that. Sondermind.com, I know I mentioned that in another prenatal care plan. They're just a really good resource because they can connect you with a counselor, and it's almost always covered by insurance, and it's telehealth. So that's really nice because you can do it in the convenience of your own home. This can be something that's kind of hard to bring up or hard to talk about, and it's something that we should definitely be talking about, especially with our healthcare providers. So I think sometimes it can be a little bit easier to talk about those kind of things if you're in your own environment. Telemind is another resource where you can meet with a counselor virtually, and there's tons of research showing that sex during pregnancy is okay. Mayo Clinic says that it's okay. It can even help reduce some stress. ACOG says it's okay. Every resource, as long as you're comfortable and you're low risk, there's no bleeding, no contraindications, you've talked to your healthcare provider, you don't have any risk factors, it is okay to continue having sex. If you are not in a monogamous relationship, it's probably a very good idea to use some type of protection against any kind of infections or STIs or anything like that. Other than that, it's an okay. So, thanks.